My name's Sylvie Silver. I'm the Director of NAPA, which stands for the National Association for Providers of Activity for Older People. We're a nationwide charity and a registered company, and we specialise in enabling care home staff to support older people to live life the way they choose, in the way they want, with meaning and with purpose. Dementia is an umbrella term, really. It's a collective description of a number of diagnosed illnesses. Things like Alzheimer's disease are one type of dementia. So there can be a whole range of things that cause this set of symptoms, but they are common in how they present to somebody, and a diagnosis of dementia can then hopefully be refined into one of these other areas. Well, we describe activity as everything you do from when you open your eyes in the morning until you go to sleep at night, because your brain is engaged at or with something at any point when you're not actually asleep. And an old definition of activity might have been doing things or joining in with a group session or an activity that's laid on by somebody else. But actually engagement and something meaningful and purpose is an activity. Because we all need activity to give a meaning and purpose to life. The days are very long when the walls are the same. So if your day is simply defined by getting up, washed and dressed, and sitting and waiting for lunch, we're looking at about 11 hours in a care home resident's life of trying to fill those hours with meaningful engagement, something to do, fun to be had, something to look at. So it might just be sitting at a window and watching the clouds go by if that's what you enjoy. It may be getting outside. It may be simply choosing what colour cardigan to wear is an activity. The critical thing in dementia care is that we do have these many hours in a day where engagement can make a huge difference to somebody. And we know from there's a really strong evidence base that you can reduce the use of what they call antipsychotic drugs, drugs that suppress people, subdue people, actually can be limited if someone's got engaging, meaningful things for them to do. So you might have had a history as a farmer who was always up at 4 or 5 o'clock in the morning and out collecting the eggs from the hen house. So it might be important to you to get up at that time of day, go and have some eggs to collect. That's a wonderful activity, rather than have somebody constantly saying to you, have a cup of tea and go back to bed, because that's how your lifestyle has been. And for you, that's something that has meaning and purpose. Activities are 24 hours a day, 7 days a week. One of the things we suggest to people is to have something called a night owl club, where things are available in the middle of the night. Because if you have a dementia, you may not continue to sleep for 8 or 9 hours at night. You might do, but you may be up in the middle of the night, and that's when you need something to do. We've got a lovely care home we work with where they do all the laundry at night, and they fold the napkins and they iron things, and the residents get up and join in. So it's very much about being things available to do 24 hours a day. Old culture activity, which is the traditional programme on the wall that says we lay on these things, and if you choose to come, that's up to you. The new culture of activity, and the way the regulator looks at it now too, is to say there has to be something meaningful available for everybody in the care home. So that may be somebody who very rarely comes out of their room, that they choose to spend their day in their room. And we need to be able to define that maybe they watch the 9 o'clock breakfast TV programmes and they listen to the radio later in the day. They might be entertained by some knitting or a jigsaw puzzle, but that for them is an engagement. So it's that new culture is about looking at each and every individual in a care home and saying, what is their activity? What does their day look like? How is this person spending their time? A lot of the care homes we work with now are trying to work that way. Reminiscence in old age is no different to reminiscence in younger age. We all reminisce all of the time. We talk about what we did yesterday, what you saw on the TV. That's a reminiscence. In older age, of course, we have a lot more life to look back on. So it is important. In dementia care, for some people, gathering pictures, life story, information about their background helps us to give them this much more active, engaged lifestyle. It's important to know someone's life history, which is slightly different from reminiscence, and people mix the two up sometimes. So knowing someone's life and background really helps you to offer the right things to them. Being able to talk with somebody and reminisce is a lovely skill that most of us have. Don't always need specialist training to be able to reminisce with someone about what's happened in the past. I've got a very personal story of a chap we worked with in a care home in the south, who, when he moved into this particular care home, was quite distressed, very little communication skills, and spent all of his time stacking the furniture up into the middle of the room. And initially the care staff were a bit flummoxed by this and couldn't quite work out how to manage and deal with the scenarios that arose from having stacks of furniture suddenly appearing in the middle of the room. But the manager and the staff sat down, did some life history work, and discovered that he used to be a painter and decorator. And there was a sense that perhaps he was preparing to work, that moving the furniture, covering it up with tablecloths was actually a step back into a time where he was in that work environment. So they went out and provided him with paint pots and roller trays with water in the pots, and realised that he was very happy and contented by painting the woodwork around the care home with water. Totally different chap when I went back to see him a couple of months later. Calm, contented, strolling around, sometimes picking up a paintbrush, other times with a roller in his hand, rollering the walls, and a very happy and contented chap who actually had then stopped stacking up the furniture. That to me is a perfect example how a combination of life history and providing an activity personal to him made a big difference to his quality of life and the care staff that were trying hard to care for him.